show. We're going to begin our news briefing with our homeless programs and success stories topic. As many of you know, Monterey County's aggressive initiatives to end homelessness are not going unnoticed, with state and federal partners elevating these successes that we've been having. And at the root of the success is a very strong collaboration between the county and city jurisdictions. Next month, the Coalition of Homeless Service Providers will be hosting the 2023 Lead Me Home Summit, where federal, state, and local partners are going to focus on strategies to end homelessness. So today we're going to talk a little bit about the summit, but also the successes that we've been having with these programs. And we're very pleased to have Lauren Suwansupa from our Department of Social Services and Genevieve Lucas-Conwell, who's the Executive Director of the Coalition of Homeless Services. Thanks, ladies, very much for joining us today. And I'd like to get started with, I'm not sure which one of you would like to start, but it's really great to be talking about successes in this area.
Hello. My name is Genevieve Lucas-Conwell. Thank you, Maya, for the kind introduction. It's a pleasure to be here with you all. In terms of successes, well, we really see the proof in the data that Monterey County being a leader in reduction in homelessness, with about 28% reduction since the start of our Lead Me Home plan, which started in 2021. And we see that impact with regional strategies, with over 150 units being built for permanent supportive housing throughout the pandemic, with home key projects. And we're really excited. Maya, do you want me to go through a little bit of what our responsibilities are here at the coalition?
That would be great, because there are often questions about how the county and the coalition work together.
Yes. So the coalition is the COC lead. So that's the continuum of care lead. And so we are the entity responsible for supporting our unhoused residents and making sure that we have a regional strategy to support our unhoused residents. So that looks like our Lead Me Home plan. So our Lead Me Home plan and our COC board, the Continuum of Care Board, the Leadership Council, wrote this plan in 2020 with a lot of data and input that was brought in locally in terms of how do we support our homeless population in the most effective way. And there were three overarching focuses when it came to building out this plan. One of them is the participation of stakeholders. So making sure that we have all the stakeholders at the table, which is really elevated by the strong city and county collaboration that we see to this day on our leadership council and throughout the county. We also have improving our performance system as the second focus of our plan, as well as making sure that we increase support on the ground. Our overarching goal with the Lead Me Home plan is to reduce homelessness by 50%. So I mentioned that we reduced homelessness by 28% since the start of the plan. So that we're doing really well. We're halfway through our plan. We're seeing those successes come through. We have incredible collaboration from our services providers, extended our outreach quite a bit. We started out with limited amount of outreach teams, about 3 outreach teams, and now we have about 12 outreach teams. So we really make sure that our folks on the ground are receiving those services. And that data point that I mentioned about reducing homelessness by 28% is from our point in time data. So that's one of our responsibilities, is to conduct the point in time census that gives exactly what we mentioned here, a point in time on what is homelessness looking like in our county, who's experiencing homelessness, and why. So we are actually conducting our biannual census in January of this year, and we are always accepting volunteers. So we'll be starting that process very soon. And that's a really great way to get involved with our process. And as the continuum of care, we're responsible for coordinated entry and the homeless management information system. So we're also in charge of making sure the data is correct and setting policies based off of the data so that we really inform our policies on who's experiencing homelessness at any given time with folks with lived experience. And with that, I'll add also that we are at the Leave Me Home Summit that Maya, you elevated so wonderfully. On October 19th, we will be hosting an input session for our homeless housing assistance program. There's a 5th run of funding that's coming through the state. And that will be, we are looking for community input to really inform our plan to the state as to how do we want to support local initiatives, what is a priority for our community. We are strong believers at the coalition that we create community processes. So everything that we do is for the community, by the community. So I'll leave it at that if there's any questions.
So for people who may have questions for Genevieve, go ahead and you can put them in chat or hold on to them and ask them in person. But I want to transfer over to Lauren and talk about the county connection and collaboration with the coalition.
Yeah, thank you. Happy to do that. You know, I think as Genevieve ran down that list of responsibilities that the coalition has, you can really see that it's an enormous lift that it takes in order to address a problem like homelessness. And in order to be productive in moving towards a solution, it really is about a collaborative effort. And so, you know, the county really is at the table in, you know, formally adopting that 5-year plan, encouraging other local jurisdictions to adopt that plan and work collaboratively together. And, you know, we've really seen a clear shift from, you know, our from higher levels at the state, at the federal levels that are telling us this is how they want us to do this, that our funding sources like the HHAP that Genevieve just mentioned that require our community input sessions that are utilizing this best practices, they're all telling us you really need to come up with this fund. You really need to work together, that you have to do these collaborative investments in order to be effective. And the county has really been doing that a lot in the past couple of years. You know, with our first rounds of HAP, HHAP funding, we've been able to secure really incredible partnerships. You know, we've had some very productive outcomes with Project Room Key, in which was a program that we partnered with multiple service providers to cover all different aspects of, you know, what a person might need in order to help stabilize from their health care, from mental health, potential substance abuse, and of course, housing navigation. And we were largely successful in being able to help stabilize that population and direct most of the individuals who are in that program into permanent housing outcomes. Other relationships that we've built through an MOU with the city of Salinas. We co-fund and operate the Share Center in Salinas, which is a navigation center that provides emergency beds. Street outreach, like Genevieve had mentioned, is only successful in our community because of multiple financial investments that come from the county, from the coalition, and from our managed care provider funding sources. So it really is this collaborative effort that we have to come together in order to braid funding, partner in order to make a big impact. There is no way that we can do any of these things alone. And the more that we can join that conversation, come to the summit, be a part of this experience, hear about what you can do, because it isn't a problem that's in someone's backyard, it's in all of ours. And we really do need to partner together to be able to come up with a collective solution that we're most strategic with the limited funding we have, the efforts and resources that we have, we need to work together. So we're really happy to kind of uplift that message and invite people to the conversation.
For people who have questions for Lauren or Genevieve, go ahead and put them in the chat, or you can raise your hand. One question that I do have for you ladies is, we talk about county and city jurisdiction collaborations. How do cities get involved with working with you?
Yes, I'm happy to take that one. And so one wonderful thing that we've been with this plan that's allowed us to do is have cities adopt our Leave Me Home plan. That was our big ask last year. And, you know, we've had the opportunity for some cities to rise to the occasion. So we have about, we have the city of Salinas that's adopted the plan. The county has adopted the plan. They were the spearheaders in that. So thank you so much to the county for that and really just, leading that initiative. Following behind them was King City. We had County of San Benito, since we're the COC for San Benito as well as City of Soledad and the City of Monterey. So that's a great way to really show cities and its constituents that there is a plan in place for your unhoused residents. And this is exactly how you want to support your unhoused residents, and an action plan that is derived about how do we want to meet this plan. So that's a great way to get involved. Our leadership council is open to the public, and it is every other month, and it will be hosted in October, and it's on the third Wednesdays of those months when it happens every other month. And those links are on our website. So if you're not exactly sure when they happen, so that's a great way to get involved, and as well as signing up for the census and being active participants in the census so that we can really make sure we're accurately painting a picture of our unhoused population and capturing everybody that we can.
And then another question, Lauren, you mentioned Project Room Key. I think many people associate Room Key just with COVID-19, but it turns out that that program really pushed people in a good direction, where it was more than just, it did more than just save their lives from COVID. It actually moved people in a better direction.
Yeah, you're right in that Project Room Key was a COVID response program, and it really was focused on trying to help individuals who were the most health-wise vulnerable to have serious consequences should they catch COVID. But it created this opportunity to connect individuals who had been disconnected from services and from a response system, and be able to stabilize them. Most importantly is their health needs, in which were not being addressed while living homeless. And be able to really surround them with the type of services that could lead to positive outcomes. When you think about, somebody who is in crisis, being able to ensure that their shelter, their food and physical needs are met first, they were then able to then really focus in on how to overcome some of their barriers to stability. And that really came out in, the outcomes of that program. It was 83% of the individuals from our Project Room Key version left the program into positive permanent housing destinations.
And that's one of those post-COVID good news stories that just doesn't always get out there, but it's just, and do you think this is part of the success, where the state saw what we did with Project Room Key, the state and federal partners, when it came to grants, saw that we really were moving people in a positive way, and that kind of helped us get more funding?
Absolutely. I don't think that the programs would have continued to receive funding if we hadn't shown outcomes and progress from them. So it really was a testament of the state seeing that this was a method that works. And it's why other communities continue to utilize motel rooms as a stabilizing method of providing non-congregate shelter that really does work.
And then Genevieve, do you want to talk a little bit about the summit, what people can expect if they sign up? I know they can sign up on your website, but what is on the agenda?
Yes, absolutely. So as you mentioned in the opening, Maya, our focus is to bring partners to the table. We want to understand how can we end homelessness. So a part of it is actually talking about our plans, the intersectionality of different plans. So there's a federal plan, there's a state plan, there's the at-home plan from the county, the League of Cities, CSAC. And so we're going to have a robust conversation around how do these plans intermingle with our local plan? What strategies should we be looking at locally to make sure we're addressing our unhoused population here? We're also going to be looking at the intersectionality of health and homelessness, and homelessness as a social determinant of health. We're going to be looking at the inequalities, social inequalities and policies that we actually have in our county that might be putting some blockers and challenges and barriers to our unhoused residents, and putting more forward-thinking policies to support our unhoused residents, and not just unhoused residents, but our residents that might be experiencing some hardships and might be at risk of homelessness. So we're going to be really having a wonderful conversation. We're also going to be looking at coordinated entry. We're going to be bringing in our lived experience councils to really talk about, their experiences with different policies. So we're going to really have a breadth of different conversations from policy. We're also going to have some workshops for service providers. We're really, really excited about the different conversations that we're going to be hosting at the summit to focus on that goal of how do we reduce homelessness by 50% by 2026.
And the first summit was virtual, but this year we are in person so people can mingle and talk directly.
Exactly. It's going to be at the Steinbeck Center. I'm going to be dropping in the link here on the chat so everybody has access to it. And the best part is it's a free event and we are hosting Dorothy's Place as the caterer. So we're really just trying to bring in that tapestry of services. Homelessness is not just homeless services. It's cities, it's policies, it's a judicial system, it's youth services. It touches so many different sectors. So how do we bring them all in for that same conversation of supporting our in-house residents?
Thank you, Genevieve and Lauren. It's really great to share good news on this topic, and we really appreciate your time today coming to speak with us.
Thank you for having us.
And now we're going to turn to a town hall that is scheduled for tonight in Castroville. The County of Monterey is hosting a town hall meeting about the Moss Landing lithium-ion battery energy storage system facility. Easy for me to say. The facility has had some emergency incidents over the last couple of years, and the town hall is an opportunity for local residents to ask questions and get information. We're very pleased to have Kelsey Scanlon, the director of our Department of Emergency Management, here to talk about what to expect for the town hall tonight and the type of comments or questions that people might have. Hi, Kelsey.
Hi, thank you so much for having me. So as Maya had mentioned, the Monterey County Department of Emergency Management has been organizing several agencies and elected officials to participate in a panel discussion this evening at the Castroville Recreation Center at 11261 Crane Street in Castroville, starting at 6:30 to discuss the Moss Landing lithium-ion battery energy storage system, also known as a BESS. And so we'll have presentations from Vistra Energy Corporation, Pacific Gas and Electric, Monterey County Environmental Health Bureau, the Department of Emergency Management, Senator Laird's office, and Assemblywoman Addis. And so there will be opportunity at the end of the town hall meeting for people to either write questions on a card to have handed to the panelists to respond to. And if time allows, there might be some additional opportunity for people to speak on the mic. And so we're looking forward to hearing from the community. We're looking forward to sharing public safety information. The Monterey County Sheriff's Office, as well as North County Fire Protection District, will also be present. And we're just really excited to continue to talk about this clean energy solution and ways in which we could move forward in increasing public safety as it pertains to new technologies. So
if there's any questions for Kelsey, you can raise your hand or put the question in chat. Kelsey, you've got a lot of people submitted questions in advance. So it seems like there's no shortage of people who have a lot of questions about, what's the safety at the location? How, do first responders get out there? Is there a common theme among these questions that you might have seen, or are they just really all over the place?
No, I think what's common among all of our extremely diverse communities is that they have a thirst for knowledge and they like to participate, which we love. And so I think the most common theme is that there is a lack of understanding about the technology and about what it means for them as residents and what government services and what private industry are doing to mitigate those impacts to the community.
So we're really looking, and so for people who also don't know, the meeting will be live streamed. So people who cannot get out to the recreation center can watch it on the Monterey County YouTube or Facebook page. And Kelsey, we have a lot of questions submitted, but anyone who submits a comment on social media will capture those comments, but the people who are at the meeting may not see them. So we just want to let people know that their comments are welcome, but they may not get if they have a question, they may not get answered right then and there. Thank you very much, Kelsey, for kind of giving us a rundown of how the meeting is going to go. And we're really looking forward to hearing what people have to say.
Thank you.
Thank you. It's always a good time now to talk about suicide prevention and how those in crisis can get the support they need. It's a conversation that saves lives. As many of you know, September is Suicide Prevention and Awareness Month. This is a great time to highlight services, including the 988 Suicide and Crisis Hotline and how it works. We're very pleased to have Katy Eckert with our Monterey County Behavioral Health Bureau Chief to talk about not only the awareness and the month, but really tell us how 988 is helping people. Because I know when it launched a year ago and there was a lot of splash, but not much, we haven't heard much about it since that time. Hi, Katy. Thanks for joining us.
Thank you so much. Yes, so one of the things that, while 988 is relatively new, the reality is the National Suicide Prevention Hotline has existed for a number of years. However, that being said, it was a long number. People didn't remember it. It didn't just roll off the tongue. And so there was a campaign to make it something very accessible to all. And thus 988 was created. For us, that goes to our Family Services Agency of the Central Coast. And they are the providers of our local, our local answerers for our region, for the National Suicide Prevention. There is now an ability for them to also accept texts, as well as answering the phone directly. And so again, lots of supports that have existed and continue to develop. One of the other pieces about this, so trained staff 24/7 to answer the call, to really try to help people get stabilized, to be able to make referrals to 911 when needed. And one of the things that we're really excited about doing here in Monterey County, we're looking at how do we tie closer together our County Behavioral Health Bureau and mobile crisis operations and support that we are developing and hopefully rolling out this fall, to really make it a much more seamless process for people who need help. And so what we have started our conversations with, because right now what exists, people can call us at the Behavioral Health Bureau, but I'm just going to say, I don't think our community can rattle off our behavioral health phone number at the top of their mind. So whether you're calling on your own behalf or whether you are calling on behalf of someone else, it's a process to look up a number and try to figure that out. And so 988 exists. 988 is there for crisis. We are looking at partnering with the 988 system to not just answer national suicide hotline calls for our communities, but also to answer and be that warm line for behavioral health calls. The trained staff are available. The guidance is available. There is still the ability for them to call 911, referral into the 911 system when law enforcement needs to get involved. Or as we're building up this additional infrastructure for mobile crisis supports for our communities, they will then be able to also make a referral to our mobile crisis teams, and then go through a separate dispatching methodology to either get, we currently have Seneca, who responds for children and youth mobile crisis on a 24/7 basis. And we are looking at bringing on a new contractor again this fall to provide additional 24/7 mobile crisis response throughout the whole Monterey County. And we have our existing mobile crisis, which is we have three clinicians who are based in different regions of the county that co-respond with law enforcement when needed, and they are dispatched through the 911 system currently. We're also looking at how do we do maybe some new creative mobile crisis work, and looking at doing pilots with the city of Salinas and possibly some other communities as well. Again, just really looking at how do we serve our community in a much more efficient and effective way by really building the partnerships and the relationships behind the scenes so it seems seamless to each of the individuals who need our service. The other thing I just really want to say as it comes to looking at supporting the mental health of our community and reducing the incidence of suicide in our community, every single one of us has a part to play in that. Every single one of us can be there and support our circle, be a caring individual who is willing to listen, willing to be present, willing to engage with someone who is struggling with something, so one of the things that we do, I don't know if you can see, but I have these green wristbands. There's something that behavioral health is sharing with the entire community, and what they say is, "You matter, I will listen." And we have them in either English or in Spanish. And when you wear this wristband, you're signifying to the community that to your circle in the community, your friends, your family, the people that you are close to, that you are willing to be there and listen, that you will be, you're going to pay attention. You're going to turn off the TV. You're not going to be checking your email while you're listening. That you will reflect back what you're hearing from them. That you're going to normalize the experience. That say, "Hey, most people dealing with this are going to find it stressful." You are going to ask what you can do to help, and you are going to avoid giving advice unless they specifically ask for advice. And so by doing simple things like that, and then also when you feel like you're in over your head, being able to reach out to, say, 988 for additional supports, we all can play a role in really helping our community get healthier and better and really make a difference in people's lives.
Katy, what you're just saying, it's bringing a very personal approach, a local and familiar voices for people here. So we've got people who will wear a wristband and help their friends. We've also got at the other end of 988, which may seem like a national number. At the other end of that line, there are people who live here. There are people who would understand the person, where they're coming from, maybe understand the environment. They could speak to them in a friendly way because they're the same. They're the same. They know where they come from.
Yes. And, it's meant to be supportive, not intimidating, so it's okay to pick up that phone and call. And a lot of times people get the help they need by just making that phone call and having someone listen. And then other times there's additional supports that are needed. But again, those supports are there because everyone cares about our community, and we want everyone to be healthy and well. And if we have a heart attack, we're not shy about reaching out for help. We need to not be shy about reaching out for help when it comes to mental health supports that we need.
It also sounds like the mobile crisis pilots and other things that you're working on, you're really looking at how people live right now. I mean, I think there's ways that were done in the past that were good and work then, but the environment where people live right now are very different. 10 years ago, people were living different lifestyles. Now you're trying to meet them where they are.
Absolutely. And then the other piece is, I mean, who here has gone to the hospital emergency department? It's a very, very busy place. And typically, when individuals show up there, you're in for a pretty lengthy experience of being there. And so two things that we're able to do when we do community response, not everyone needs to go to the hospital emergency department, which then frees up the hospital emergency department to focus on the people who absolutely need to be there. And it's a better experience for the people who don't need to be there to get their needs met where they are at in the community without having to go through the stress of an emergency department visit.
And last but not least, where do we get our green wristbands?
That is wonderful. You can contact my secretary, Martha Guzman, and she distributes packages of the wristbands as well as the instructions out to different community partners requesting it or to individuals requesting them. And so yes, I can put her email in the chat, and let me go ahead and do that.
Katy, thank you very much for sharing this information. It's great to see what's happening with these new programs. And it's great, I think, for people to know that they're really warm human beings on the other end of 988 that live where people live and really have those connections that they can make.
Yes.
Thank you for joining us today.
Absolutely.
So in our last topic today, North Monterey County is going to have a little bit of a celebration this week. They're going to celebrate a road reopening along with easier access to a very loved local park. Kirby Road, which leads to Kirby Park, suffered storm damage back in 2017, and the county has worked very hard to try to keep that road available in some form or another for the last few years. Well, now the road is complete and the park is more accessible. And we're very pleased to have Erich Rauber from our Public Works Department. He's a senior civil engineer. And Erich, I'm hoping you can tell us more about the repairs for Kirby Road and what that means for people utilizing the park there. And we can't hear you. So you're not muted, but we still can't hear you. You might want to check your computer.
Okay, how about that?
Gotcha.
Oh, excellent. Okay, thank you with that little stall out there. Thank you for having me, and excited to talk about the opening of Kirby Road and to talk a little bit about the Kirby Road culvert replacement project. I'll share my screen here just so I can give you some physical context here. Okay. Can everybody see that?
Got it.
Okay. Kirby Road Park is located essentially as shown on the map. It's a county maintained road that leads to Kirby Park, which is maintained by the Moss Landing Harbor District. During the 2017 storms, the erosion of the eastbound lane of the slope adjacent to the eastbound lane started to erode and cut into the embankment, and it created an erosion gully that encompassed the more and more of the eastbound lane. And last year, during the heavy rains we experienced in the spring, further eroded it to the point where the road had to be closed even to pedestrian and vehicle traffic. Move this down. Here's a aerial view. This is Elkhorn Road on the right-hand side of the screen. You can see the K-rails that are protecting this erosion gully. This was a couple years ago, and since then it's continually creeping to the north and affecting this lane. With some emergency permits that we obtained from the Corps of Engineers, construction started around August 9th and included removal and replacement of the damaged culvert, along with the placement of rock slope protection into the eroded area of the roadway to safely support Kirby Road. This is a sort of a pre-look at the road, and you can see that the narrowing of the road was continuing and actually starting to undermine the K-rail shown there. And that's sort of a alarming view of the erosion that was occurring and continuing to cut into that eastbound lane of Kirby Road. And this is sort of a cross section of the repair. The rock slope protection I described was placed on in that eastbound side to prevent further erosion and reestablish that eastbound lane. New culvert was replaced an old corroded 60-inch culvert, and then the road was rebuilt. You can see some of the construction ongoing, the placement of the rock slope protection over the culvert, and then the final paved surface that is shown on the screen. That's basically a description of the project. Like to thank our construction contractor, Granite Construction, and county staff, including Juan Mesa, Marco Becerra, Doug Pachulian, Edgar Rizzo, and our environmental consultant, Denise Duffy and Associates that worked hard to get this environmental permit in place. And as you mentioned, Maya, there's a ribbon cutting tomorrow, I think at 10 a.m. Is that correct?
Yes, I think so.
We formally opened. We will now have two 10.5 foot lanes. There won't be the striping won't occur until next week, but nonetheless, the road will be open, and we're excited to formally open that tomorrow.
And this is really a long time, such a long time in coming. I know that when during part of the year, Public Works was really trying to keep the road open, at least part of the road, so that people could get back and forth there. And really a lot of effort went in to try to accommodate the community who loves to, go down that road, go to the park, and use all the amenities of the park there. That's right. It had to be closed in the wintertime. The county opened it again for several years. And then after the 2019 storms, it was open just to pedestrian traffic. And but then with last year's storms, it became imperative to repair it. We're still trying to get funding from FEMA, as we have been since 2017. Still hopeful to do that, but yeah, that's yeah, attend the ribbon cutting tomorrow. Great news, and let's invite FEMA too, and we can hand them the bill while they're there, right? Perfect. Thank you very much, Erich. This is such great news, and I know there is a lot of excitement for this in North County among the residents who love that park there, and the road is so important to utilizing that. Yes, indeed. Thank you. Thank you. And thanks everyone for joining us on the news briefing today. Our next briefing is next week, and we'll see you then. Bye-bye.